is Preeti and you're watching my resolution. In this video, I'll be teaching a deltoid muscle, which is a RS question and an important question for the university exam. This will be asked for a 5-mark question. This is the one muscle which performs the three separate muscle fibers will be combined and inserted into the one particular muscle, and three in one muscle, because its action will be three and the three separate parts will be there. And so the deltoid muscle is a three in one muscle, we can say, and it is derived from the deltoid. Delta is a Greek letter. This is deltoid is derived from the Greek letter. It is a triangular muscle. As you can see, this is a triangular muscle. This is a triangular muscle. This is our anterior fibers, posterior fibers, and the middle fibers. So this is a triangular muscle. This is a strong muscle and thick muscle. It is powerful muscle. It is curved on the shoulder joint. You can see here. This is the shoulder joint. This is a shoulder joint. It is curved on the shoulder joint. These are anterior fibers. These are middle fibers, multi-pinnate, which anterior fibers are unipinnate. These middle fibers are multi-pinnate, and whereas these posterior fibers are also unipinnate fibers. And you can see these have V-shaped origin. So you can see here, this has V-shaped origin, anterior fibers, middle fibers, and posterior fibers, V-shaped origin and V-shaped insertion. Insertion is also V-shaped. They combine and form a single tendon and then inserted into the V-shaped deltoid tuberosity. So anterior fibers are unipinnate, middle fibers are multipinnate, and posterior fibers are unipinnate. Anterior fibers arises from the lateral 1/3 of the clavicle. You can see here lateral 1/3 of the clavicle. Lateral 1/3 of the clavicle. If you consider this entire as one clavicle divided into three parts, this will be medial. This is middle, and these are lateral. So lateral 1/3 of the clavicle in the anterior aspect, on the superior aspect, anterior border, this comes and then lateral border of the acromion process. This is acromion process, lateral border of the acromion process, and lower lip of the spinous process. This is entire thing is a spinous process. This is upper lip and this is lower lip, and lower lip of the spinous process, and then they go and insert into the deltoid tuberosity on the middle of the and the lateral aspect. This is the medial aspect of the humerus, shaft of the humerus. This is the lateral part of the lateral aspect of the shaft of the humerus, in which shaft of the humerus exactly at the middle on the lateral side it goes and inserts. So origin, V-shaped origin. Insertion is also V-shaped. Insertion also, it forms a V-shaped insertion, V-shaped origin. Anterior fibers unipinnate, arises from the lateral 1/3 of the clavicle. Then and the anterior border only, and the upper aspect. Middle fibers from the lateral margin of the acromion process, and the posterior fibers from the lower lip of the spinous process, and inserted into the V-shaped deltoid tuberosity, which will be mid aspect of the shaft of the humerus. That is lateral aspect. This is lateral, this is medial. Lateral aspect, this is the shaft of the humerus, middle of the shaft of the humerus. And nerve supply will be axillary nerve. Here in the neck of the humerus, axillary nerve surrounds the neck of the humerus and supplies teres minor and deltoid muscle. So now supply will be axillary nerve, root value C5 and C6. And actions will be the three parts perform different actions. Anterior part perform, this will be anterior. This part performs flexion. This is a flexion of the arm. Flexion and medial rotation. Flexion and medial rotation are performed by anterior fibers. Oppositely, so posterior fibers extension and lateral rotation, whereas the these middle fibers provides abduction. This is abduction is taking taking the arm away from the rib cage. So anterior fibers performs flexion and medial rotation, whereas the posterior fibers perform extension and lateral rotation of the arm. Middle part and the strong abductors of the arm from 0 to 15 degree. Infraspinatus abduct the arm from 15 to 90 degree. Deltoid muscle will abduct the arm. So from 0 to 15 degree, that is initiation of abduction cannot be performed by deltoid alone. So infraspinatus helps in abduction of the arm. And clinical significance is intramuscular injections, as during childhood and all, the vaccines are all given here. Intramuscular injections are given in the lower half of the deltoid. This is a deltoid exactly. Lower half, we provide injections in the lower half of the deltoid to avoid injury. Here in the upper half we have axillary nerve. To avoid injury to the upper half, axillary nerve, we apply injections in the lower, we inject injections in the lower half of the deltoid muscle. This is a site of injection where we inject in the lower half of the deltoid muscle. This is the site of the injection. Here will be the axillary nerve. So to protect to preserve axillary nerve from the damage, we insert in this region. This is a site where we inject this thing. And structures under covering deltoid is also important. I will be dealing that will be in the other separate video. These two diagrams you have to write. This will be usually asked for 5 mark question, so you have to write the diagrams as well. This diagram, write first the right scapula, then spinous process. This is the clavicle. So origin from the V-shaped origin from the 3 parts: lateral aspect of the acromion process, lateral border of acromion process, upper aspect in the anterior border, lateral 1/3 of the clavicle, and the lower lip of the spinous process, and those all will go and forms a single tendon on the 3 separate fibers and inserted into the V-shaped this is deltoid tuberosity on the humerus in the lateral aspect at the middle of the shaft. And this is this diagram for the insertion. This is for origin and how these fibers are will be unipennate or multipennate. This is a single fiber, so unipennate. These are multiple 1, 2, 3 and 3 separate fibers. They form same tendon and inserted into the deltoid tuberosity. This is acromion process from the lateral border of the acromion process. These are anterior fibers, posterior fibers, and this is a multipennate. They are inserted into the deltoid tuberosity. This is important question, as they have asked in our batch also. This important question. You have to write subheadings and diagrams and present neatly so that you gain more marks. Thank you for watching.